Hey, welcome to our webinar on NCLEX medications. I am excited to present this information to you. I know that you'll find it very helpful. A lot of our nursing students have found that these little webinars with practice NCLEX questions have really made their studying a lot funner than nursing school, and the questions really help with retaining the information. So let's go ahead and get into it. Alright, today we're going to be talking about angiotensin converting enzymes inhibitors. I'm going to call them ACE inhibitors for the rest of the presentation because it's a whole lot easier to say. Alright, so very first thing, let's talk about what are ACE inhibitors. Pretty much it's a drug class. Okay, you'll find a lot of the medications end in PRIL, such as captopril, lisinopril, fosapril, ramipril. So this is an easy way to identify these medications, and they're usually used for high blood pressure, hypertension control. Okay, they're also used for other things such as patients that have congestive heart failure. They also help lower the risk of stroke and also heart attack. So patients that have elevated risk of stroke and heart attack can also get benefit from using these medications. So let's talk about some of the nursing considerations for ACE inhibitors. So I remember taking care of this patient, and they were on an ACE, and it was for their blood pressure, but they had also some other disease or other problems that they had going on, and he just wasn't compliant with his medication. So a lot of the nurses before me said, "Hey, Jonathan, this guy, he's a frequent flyer. He's kind of being readmitted. He's not taking his medication. Blah blah blah." Nobody really wants to kind of take care of this guy because he's a frequent flyer and he's not doing what he says, right? So I'm talking to him, just developing a rapport with my patient, and just trying to figure out, what does a guy like? What does he like to do? Letting him know a little bit about myself and my family. And then, I brought up the whole medication thing and said, "Hey, this is not your first go around. What's the deal with the medications?" He says, "Jay, I just can't do it." I said, "You can't do what?" He said, "These medications." I said, "Well, they're going to help you to live a lot longer and to have a, higher quality life. What is it about the medication that you don't like?" I could tell he wanted to tell me something, but he just wasn't bringing it out. And I said, "Just lay it out." I said, "Hey, I'm a nurse. I've heard it all." He said, "It doesn't help getting it up." I said, "Getting what up?" He says, "Sex. These blood pressure medications, they just don't do it for me." And it was just funny for me to kind of think, and I kind of chuckled and laughed, and we kind of made light of the conversation. But sexual dysfunction is one of the side effects for medications and a reason why some patients are not compliant. Now, if he would have just let, his nurses or physician know this before, maybe they could switch the medication or came up with something else. But long story short, I let the physician know this information, and she just kind of laughed because it was one of those things where it's like, man, all this time I've been treating this guy and I didn't know why he's not taking his medications, and he wouldn't open up this information. It probably helped that I was a male as well. But hey, we switched the medications, we got him a little Viagra, he was a lot better, and I didn't see the guy anymore. So that is a win for us and also a win for the patient. So let's talk about some of these nursing considerations for giving these medications.
What are you doing? What are you doing, Daddy?
Daddy is recording, and you just came in and talked to me.
Are you recording that?
Yeah, I'm recording.
Come on. You can't be in here while we're dead.
Alright, back to the presentation. So here are some of the things that you should consider as a nurse. One, you want to report any history of angioedema. Well, what exactly is angioedema? It's a nice fancy word for saying swollen face, fat lips. Sometimes when you take this medication, it's one of the side effects of ACE inhibitors. And it's not really a problem unless you have some type of chest pain or the airway starts to be compromised due to the swelling. Okay. Also, you don't want to take over-the-counter medications with this, because over-the-counter medications such as ibuprofen and NSAIDs can cause your electrolytes to be off balance, and then you have increased sodium, increased potassium, which is not good for the heart. Also, this medication is not recommended for pregnant or lactating women. You always want to assess for allergic reactions. So you're looking for hives, you're looking for itching, you're looking for those swollen lips or swollen eyes. That's always going to be a sign that the patient is having some type of reaction. Make sure that you check the patient's electrolyte levels, such as their potassium, because this medication will cause, or can cause, I should say, the potassium level to increase, which is called hyperkalemia. Also assess for kidney dysfunction or liver dysfunction. This medication is excreted through the liver and kidneys. So I'm going to assess abdominal pain, dark urine, urine output, loss of appetite, any signs of yellowing in the eyes or yellowing into the skin. This could give me an idea that the patient is having some liver or kidney problems. And let's talk about some of the side effects. So your patient's taking this medication, they may experience dry cough. Dry cough is expected. One of the little tricks that you can tell a patient to help with this is sugar-free hard candy. Okay. Also, if the patient ever experiences any type of chest pain, always make sure that they let the physician know right away, because this may be a sign that they're having a myocardial infarction or a heart attack. Here's some teaching points to discuss for patients that are taking ACE inhibitors. Please tell them, do not stop taking the medication. If it is not working or you do not like the side effects, let your physician know, but you do not want to just suddenly stop taking the medication. Also, this medication can cause postural hypotension or orthostatic hypotension. Pretty much what happens is patient gets up quickly, blood pressure drops, they get dizzy, they pass out. That's not a good thing for the patient, especially when they hit the ground. Impotence is a side effect, just like I told you in my story about my guy. So you always want to assess sexual dysfunction, and of course a lot of nurses are female, so this may be a little bit difficult to discuss with a patient, but guess who else you can get this information from? Yes, their significant other, because I'm pretty sure they'll let their significant other know, hey, I'm not taking this because it's not working with things down south very well. Also, they should call the physician if the patient is experiencing blurred vision, confusion, or decreased urine output. Alright, let's go over some test questions, some sample test questions. Alright, Mr. Lee here, he just started 20 milligrams lisinopril daily. Which of the side effects are life-threatening? Well, life-threatening is very significant, so I just don't want side effects. I want something that's life-threatening. Hives, not life-threatening. Arm cramps, not life-threatening. Tremors and hoarseness. I could say that's life-threatening, but let's think about our ABCs. Hoarseness, swollen face, swollen lips, causing hoarseness, causing throat closure. I think that's pretty significant, so I'm going to go with hoarseness. And yes, that is the correct answer. Alright, some of the nursing interventions that you want to consider. One, as a nurse, I'm going to do a focused health history. I'm going to also focus on a cardiac assessment. I'm going to be looking at chest pain. How long have they been having chest pain? What is their duration, character? I'm going to be assessing their blood pressure and their vital signs. This medication is used to control blood pressure, but I want to make sure that the blood pressure is within normal limits. I want to look at the ECG or EKG rhythm to look at the heart rhythm. I'm assessing kidney and liver function because this medication is excreted through the liver and kidney. Now, this medication will can also cause a decrease in white blood cell count. So why is that significant? Well, I'm going to assess the CBC because that's where I can find the level of my white blood cell count. And if my white blood cell count goes down, then guess what goes up? My risk for infection. So now if my patient has any, say, fever, they feel sick, they're vomiting, nauseous, any sign that they may have an infection, I need to let the physician know this. Alright, so let's go through another test question. Why is it important to monitor Mr. Lee's CBC results while he's taking an ACE inhibitor? Well, that's what we just talked about. High blood pressure may cause edema. Okay, that really has nothing to do with a CBC. Your RBC, your red blood cells, may be elevated. No, not the case with this one. Platelets are likely to be lowered. Nope, not the case. The case is white blood cell counts may be lowered, causing a increased risk for infection. Alright, here's another one. Mr. Lee is experiencing side effects of taking enalapril. It ends in PRIL, so I know that is an ACE inhibitor. What side effects should be reported to the physician right away? So one, I'm thinking right away. So persistent dry cough. Okay, I know that may happen. Dry mouth, not so significant. And then also edema to the lips. Now this is significant if you have chest pain or you have any type of breathing problems. But dark stools, why do I care about dark stools? One, here's a little NCLEX tip. Notice 3 of those answers have to do with respiratory. 1 of those answers is an oddball answer. Dark stools has nothing to do with the mouth. Dark stools, this is a sign of liver failure, and this is the one that you want to report to the physician right away. You're correct. I'm so smart. Alright, let's take a look at another question. And by the way, you can find a lot more of these NCLEX test questions and rationales on our website, www.nclexpreceptor.com, and then also in a lot of our giveaways and our books that we have on our website. Alright, so here we go. What are the expected outcomes of patients on ACE inhibitors? When I think about this question, I'm going to think about what are the expected outcomes before I even look at the answer. Well, ACE inhibitors are used as a vasodilator. These are medications that are used to control blood pressure. So now, knowing that, when I look at the answer, A has to do with blood pressure, ding, ding, ding. B, does it have to do with blood pressure? Nope, weight control. I always want patients to have a healthy weight control, so let me keep that in the back of my mind. Maintain normal serum electrolyte levels. Well, yeah, that is the case because this is possibly one of the side effects of ACE inhibitors. And then patients avoid salt substitutes. Well, I know salt substitutes are high in potassium. C and D are pretty much the same thing. A is pretty much one of the major goals, so I'm going to go with B, maintain weight control. And yes, I am correct. Alright, so that's going to bring us to the end of this little mini webinar. I want to talk to you about some free bonuses that you can get. Go to our website, www.nclexpreceptor.com. We have bonus guides to help you master NCLEX, practice NCLEX questions and rationales. We have insider tips to help you pass NCLEX. And please join our Facebook group where we post practice NCLEX questions. And feel free to share this with your friends and classmates. I know you will do well in nursing school, and good luck passing NCLEX.